welcome to, take care of your needs if you need to turn off your camera or step away, what have you. We ask that folks reserve questions for the end. We have a designated section for Q&A. All right, moving on. So again, thank you so much for being here. I am Christina Vestida Gonzalez. I am the Director of Community Health with United Way of San Joaquin County. In a moment, we'll welcome our CEO, who has a wonderful message for this group. I did want to share that the Peace Project has identified United Way as the backbone organization for the Peace Project. That will provide an overview in just a moment here. But would like to kick it off by inviting Dignity Health, a member of Common Spirit, to talk more about their involvement and their role as a fiscal agent and funder.
Good morning, everyone. My name is Gabby or Gabrielle Wilson. I'm a community health social worker with the Community Health Department at St. Joseph's Hospital. So a little background on this project, just very briefly. In 2023, we were awarded a grant in order to do some planning and research around identifying issues of violence within our community. The grant wanted to specifically fund around that theme. And we brought on our consultant JSI, which you'll hear a little bit more from Hannah with JSI in terms of what that research, what we found from doing that research and how this project fully developed. But so for 2 years, we did a planning grant that involved research and planning around violence within the unhoused populations in San Joaquin County, around Stockton. And from that, we developed interventions to create this project. And so there's more information around what the project actually is coming up in some slides that I'll go through with you guys. But I just wanted to give a little bit of background information on how we got to this point, and that part of that project was to involve a community partnership. We really wanted this to be a collaborative with community partners. And this is why you see we have this partnership with United Way as our lead backbone organization, and that we're also looking for 2 other lead agencies to implement the strategies and interventions of this project.
Thank you so much, Gabby. And then I noticed that Debbie joined us. Debbie, we're just doing quick introductions if you'd like to introduce yourself and then also speak on behalf of Dignity Health.
Fantastic, and good morning, everyone. What a pleasure to have this time and space together. I am Debbie Rinaldo, Community Health Program Manager here at St. Joseph's. Have been a part of the project since its start and its launch. We were very fortunate to receive the funding to initiate this collaborative effort of really understanding and addressing the violence within our unhoused population through various different interventions. And excited to have the opportunity to share more about the project and see what role you all might be willing to play in it as well.
Thank you, Debbie. And also presenting with us today is Hannah Young from JSI. Hannah, would you like to introduce yourself and share a little bit about your role in this journey?
Sure. Hi, all. I'm Hannah Young with JSI. We're a nonprofit organization based out of Berkeley. And I personally I grew up in Modesto, so I'm very close to the 209. And yeah, so we were brought in by Dignity Health and the St. Joseph's team to really learn about what's happening and get a better understanding of violence within the unhoused population in the area. And my role was a lot of like literature reviews and then as well as facilitating and organizing and analyzing all of the qualitative interviews and focus groups we did with folks. And I think that's all I'll say right now, because then I don't want to get too much into my piece for later, but it's nice to meet you all.
Thank you so much, Hannah. And welcoming our CEO and President, Kristen Birtwistle. Kristen, we're doing brief welcome and introductions to the project team. Would you like to kick us off before we move on?
Thank you. I'm just here to be I want to say an innocent bystander to see the great work that's going to happen from this committee and from the partnership we have with Dignity Health. So I'm president and CEO of United Way, have been for 7 years, and homelessness is a big part of what we do. And I'm just excited that this project is moving forward and is going to get some legs here quickly and soon. And I'm thrilled with this team. I'm thrilled with what's happening and what the potential is for us to get this peace project launched. So thanks for having us as your backbone convener. Thank you.
Thank you, Kristen. Well, really happy to have acquainted you with the project team for the Peace Project. We'll be moving forward where our teammates over at Dignity Health can help provide an overview of, from inception to where we are to date. So over to you, Gabby and Debbie.
Absolutely. So as I mentioned before, we were awarded a grant, the United Against Violence grant from Common Spirits Health Mission and Ministry Fund in 2023. Initially, it was a 1-year grant for planning, but as we quickly realized with any major project like this, we needed to have that extended. So we were awarded for an extension for a 2nd year plan. And during that process, we developed or created an advisory council full of community leaders, people with lived experiences, other key stakeholders, and we continue to go through all of the information that we were finding out about the unhoused population and violence. And so there are a lot of things that we discovered that helped us develop the interventions that are going to be a part of this project, the initiatives a part of this project, but there were a lot of things, things missing. And so I'll let JSI get into that a little bit more. But ultimately in 2025 of this year, we were awarded the full amount of what we proposed for our 3-year grant. So this is a 3-year project that is going to be a collaboration between United Way, St. Joseph's Hospital, and then as well as the other lead organizations that we identify. And so United Way is our lead backbone. They are facilitating a lot of the communications through all of the partners that will be involved. And St. Joseph's role is really a supportive role and primarily the fiscal agent's role. But as this is developing, we are utilizing all of our resources together to get this, as Kristen said, some legs on this project. And so that's kind of where we are at right now as a full, like an overview of it. Again, we're going to get into what the key components of that is for the project. But yeah, this is a 3-year program. And so the first year is really focusing on implementation. And then with the 2nd year, we'll be able to hopefully gather some of that data and those missing pieces and be able to strategically move things around as needed in order to move into a place of sustainability. And then by that 3rd year, really, really, really throughout every year, but really honing in on being able to identify resources and opportunities to keep this work going. And that's where we're at right now. And Debbie, I don't know if you want us to add anything onto that.
That was a great summary. I'll keep it brief just by adding that this has been truly community driven. We have been fortunate to be the catalyst of bringing these investments into San Joaquin County through our corporate healthcare system, Common Spirit Health, and the Mission and Ministry Fund that they offer our facilities. So we have been very proud of the ability to bring these funds, but these funds are really being driven by community. We have really led with the voice of those that have experienced homelessness. We have connected with individuals who are currently experiencing homelessness to help design the interventions. And the missing piece is this data. The data element is critical to really further inform our path forward for this work and our future interventions, to really elevate the level of violence that we are experiencing in our community as a whole, but specifically within the unhoused population. And so excited to be in this space of journeying this project forward. And we have a wide variety of stakeholders that are at the table as well from an advisory council capacity. So it is well beyond the main entities you see here of United Way and St. Joseph's Medical Center. We are working very collaboratively with different nonprofit organizations, social service providers, housing sector, youth focused service providers. So it is a very multidisciplinary team approach for this conversation moving forward.
Thank you so much, Gabby and Debbie. And so as we go on to the next slide, Hannah is going to walk through some of the initial findings that will inform or help us convey with you the 3 key strategies of this project and really how that has led to, this RFQ, especially for the data integration piece. Over to you, Hannah.
Great, thanks, Christina. So as I mentioned a little bit before, we led the research process for this project, and so most of the research took place in the year 2024, starting with a literature review of locals, local, state, and sometimes like national data sources, just to kind of get a general understanding of when violence is experienced among unhoused people, like what does that look like, who's experiencing, who's perpetuating, just kind of getting an understanding. And then based off that, that kind of informed who we wanted to prioritize in terms of our conversations with focus groups and interviews, as well as conversations with the advisory council, which helped us kind of who have a better understanding of the landscape in San Joaquin, Stockton area. And so we ended up having 7 key informant interviews and 4 focus groups with people with relevant and or lived experience. And so this ranged anywhere from transition age youth, LGBTQIA plus individuals, older adults, organizations that provide health services, behavioral health, social services. And then we also connected with law enforcement as well. And so we really wanted to work and do this research through a prevention lens and really think about how to frame the findings in a way that fit within that preventative lens. And so in working with the advisory council, we were able to kind of get there, but we did want to make sure that within the limitations of budget and just time and all that, and given the population in which we were doing research on it, this is not as comprehensive as maybe we would have hoped, but we do think was very very helpful information and a great starting point, I think. And part of the reason is because when we did our literature review, there wasn't really that much secondary data for us to jump off of. And so that's kind of what's led us to this moment. So Christina, if you want to go to the next slide, I'll get into what we found. Great, thanks. So we kind of broke it into systems, resources level, and then more of a community kind of your built environment level. And so from a system resource perspective, just due to the nature of how service provision is and nonprofit work is, often folks work in silos, usually not by choice, it's just how the systems are built. And so we just noticed that a lot of people were either doing the same or similar things in terms of service provision, and there wasn't really that collaborative, communicative thing that that would allow them to provide more care and help better navigate with their unhoused patients and the population that they are providing services to. And so, which then makes it more difficult for folks to navigate resources that they need or figure out where to go. Or sometimes, they can't they don't have a car, they can't go anywhere physically. And so to kind of, so there's definitely a need for um, the current organizations and service providers to kind of like work together to see how they can like fit those care gaps. And then what's brought us here, there's um, definitely a lack of current and longitudinal data around violence among the unhoused people. This is a group that moves often, and sometimes it's hard to do follow-ups. And so, um, one of the main data sources we used was the point in time count, and that's exactly what it is, a point in time. And so it's hard to track and kind of figure out progress in terms of interventions or programs. And so, um, so a lot of the data and what people are aware of that's happening in the community tends to be anecdotally and through stories and what people have heard. And so thinking about how we can marry the two of because a lot of funding like kind of requires like tangible data. And so, making sure we're able to have that. And great, thanks. And then on a community environment level, um, when we were talking with folks, what came up a lot was that there just isn't there aren't as many places for them to keep their things safe or to keep themselves safe, whether that's um, due to encampment cleanups or um, shelters stays being limited. So there's this need for us for security of themselves and their belongings, and so um, that as well. And then we also through national and state data found that unhoused people are not more likely to perpetuate violence than the general public. But the numbers and how they're reported, it just kind of shows that there's a small number, whether or not they're unhoused or not, who are actually committing the acts of violence. And so all of the folks that we talked to uh, in, indicated a trend that they saw that with a lot of formerly incarcerated people joining, re-entering society, re-entering communities, that they have noticed that as a contributing factor to some of the more violent the increase in violence that they've seen in their community. So that's something um, that that was mentioned that we thought we would bring up. Um, so this is just a very high overview. I'm sure I'm happy to answer any questions about this later if there are any. But overall, it just really showed the need for a more like collaborative structure and almost type governance structure with organizations and service providers in the area. Definitely a need for data and just kind of figuring out a way to track data efficiently and consistently so that we can so that service providers and organizations can have most accurate information in planning and implementing programs. I think I'm going to pass it to Gabby to talk about strategies, but thank you all.
Gabby, you might
Great,
be.
thank you.
Okay.
Yeah, sorry, the amount of time it takes to unmute, boy. Um, thank you. So I just wanted to piggyback off of the data information piece. So there was just to kind of summarize that there was a lot of information gathered from researching literature, articles. There was a lot of interviews conducted with people with lived experience, and the reason mostly for that was because of this lack of data that presented when looking for it from literature. And there was some information that was found about violence, but it wasn't a ton of it. And so what we really don't know is who's committing the violence, whether it's actual people who are unhoused, if they're the victims or the perpetrators, which groups are the primarily impacted by the violence. We don't know that. And the biggest thing I think that needs to be stressed specifically for this group and the purposes of the RQ was that there was some research done in the Sacramento area around data being compiled through collaborative efforts with law enforcement that seemed to be really successful. That's something that we know the reason why we wanted this project to be very community-based and collaborative is because as Hannah mentioned, a lot of groups are doing similar things and working in silo, and some may be collecting information that we need, or it's just not the right information, and other groups aren't collecting it, and it's just not coming together to paint the biggest picture. So we really want to have the data consultant be able to have a strong relationship or build a strong relationship with law enforcement, because a lot of that contact with this population starts with law enforcement, whether it be cleaning up encampments, whether it be businesses that are calling law enforcement for help. Law enforcement is responding. And so there's this huge need to collaborate the way that we collect data so that we're getting as much information that can paint the biggest picture. And that's really going to be really, really important. And then also, as we're looking at the safe storage, or the questionnaire for securing a safe storage lead agency is also there. The unhoused population is going to be on that site using those locker storages. And so it's going to be really a strong need for the data component to tie into that as well. So not just facilitating and operating the storage lockers, but working really close with the data consultant in order to get the information around tracking its success and tracking its outcomes in terms of numbers and testimonials. And so I just wanted to kind of summarize that up and just, in saying that although a lot of data was done, the right data and what we're really needing to paint the picture in order to move this project in a way that's going to be the most successful is what the real focus is here. And so from the information that we did find, one of the key things that came up is that people who are experiencing not being sheltered does not have anywhere to put key documents, birth certificates, keep safe belongings. And so if they get called for a job interview, the fear of, I can't take all of this stuff with me, where do I put it at? There was some violence indicated around people who were having experience in being having violence around times that check disbursements, when you get your Social Security checks, when you're getting your money out. And so there was this thing around not having anywhere to have safe storage. And so that came the need for the initiative that was created in this project to have safety lockers. They could be storage bins, they could be lockers. We haven't really decided, or obviously we haven't had a lead agency to really make those key decisions. So there's very much room to decide the logistics as this process takes place. But the safe storages is essentially established to try to help address some of the conflict around that. And also, sense of empowerment for people to feel like they have somewhere to keep their stuff safely. So that's our need for the safe storage lockers. And then the second piece, which we are really stressing and probably focusing a lot on, even though we definitely want to have strong leadership in both of them, is the data collection and piece, because that role is going to strongly have to partner with not the organizations just within the Peace Project, but a bunch of other community organizations and partnerships, including law enforcement, in order to gather the information that we want. And so we're really just trying to paint a picture of how violence impacts the unhoused population, and then also how these initiatives help to reduce some of that violence. Our long-term goal, 3 years, 4 years, 10 years down the line, is essentially we want to get people not only in housing, but also have them sustain it. There's a lot of research around, yes, you can get people into a place, but it's hard to really sustain it. And there's a lot of information around violence being the impact of people even losing their housing. So we really want to paint the picture of what's happening to build this narrative around how it ultimately impacts housing as in terms of long-term placement. And then also obviously make sure that the initiatives we have in place are helping to reduce some of that. And if not, how do we need to move things around within the Peace Project to get that done? And Debbie, I don't know if you want to add anything on to us being on here for.
Yeah,
beginning.
so we covered the safe environments, we covered the need for data collection, and the other
Hmm.
third element of our project is really to focus on capable supported staffing. We heard very loud and clear from our service providers that there is an opportunity to really leverage and expand trauma-informed systems training amongst the service providers as well as violence preventions training. So our initial attempt in this realm of that scope of service would be to provide violence prevention, trauma-informed care training to a minimum of two or three. Refresh my memory, Gabby. How many agencies are we launching with the
Uh,
training?
the training too.
Yeah, it is two. Okay, two to start. And so the focus will be to really support our social service providers who, again, have expressed that there is a great opportunity to really empower their staff and also increase their systems and their individual employment training for violence prevention, mitigating, having conflict resolution skill training, reducing risks. And so that is the third bucket, if you will, of intervention as part of this program. So as was shared previously, a huge opportunity on leveraging the data collection that results from that initiative as well, and the impact that it's making for this project in reducing violence, identifying and reducing violence.
Great. Thank you so much for that, for breaking down the different strategies that resulted from the initial research findings. And just a quick note that a report with these research findings is available on the United Way website under the Peace Project tab. There you can find a comprehensive report that really talks through the different methodologies used for data collection, as well as limitations to the data infrastructure that exists, and then where the opportunities lie that connect to the current strategies that have been described before you. Now moving on to the next slide. So to really get us into the lead agency opportunity, so for today we are focusing predominantly on the RFQ for the data integration. This could be a lead agency or a consultancy group, as well as the safe storage, and that method being through a questionnaire. So with the RFQ for the data integration, we're really seeking that out to help develop a framework to help collect and integrate data. As colleagues mentioned beforehand, there's a lot of gaps in the data that's available. Agencies, be it law enforcement, being service providers, who might have an incidence of violence reported to them, may be documenting differently. And so we really need an agency to help bridge the gap, but also to recommend a solution that's comprehensive enough to where pertinent information and metrics are being gathered to inform, as well as assess how effective the solution, being safe storages, is on this population, mitigating violence or preventing violence, and then the effects on housing stability. And then with the safe storage, with the lead agency helping to establish a secure storage location at their site. And then throughout the duration of the performance period for this project to help expand to other sites. Following, this session, we'll email out links to everything. At the same time, you can find this information at the United Way page under Peace Project. So to dive into the RFQ for the data integration, just to uplift that the deadline is September 29th by midnight. There's a 3-year total of 80,000 available. Please reference the RFQ for more details on what that annual breakdown looks like. And then we will be hosting a virtual drop-in office hour on September 17th. You don't need to stay the whole hour, but you're welcome to drop in if you have any questions. You are also welcome to send an email out to the Peace Project. Towards the end, we'll share our contact information for you. It is our hope that we will be able to provide an award announcement around October 13th. And so with the RFQ, there are 4 key areas that we're seeking support. Data and systems assessment. So really helping us understand the lay of the land, what that data reporting, tracking infrastructure looks like, identifying ways and where we can build alignment as well to inform violence prevention strategies. For the analysis piece, analyzing the data that is out there, identifying any trends or, are there any risk factors associated to violence that we need to be mindful of to inform preventative methodologies, as well as, with the reporting and making recommendations. We need your support to bring those forward to the group. And then again, this is a collaborative effort. We did kind of touch on what the governance framework looks like. Entities that are identified as lead agencies, they will work very intimately with everyone who's a part of the project team, but really will culminate into a leadership team for the project. Moving on to discuss some of the scopes of services. And again, this is all in the RFQ handout that is also available on our website. So there's a level of project planning and management that we are requiring, being able to develop detailed work plans, providing regular reporting to peace project stakeholders, with respect to data and systems assessment, as that comprehensive data assessment plan starts formulating, engaging key stakeholders that have been identified, and then again, really uplifting any opportunities for interoperability, especially as we're looking to have a way to seamlessly gather important information to inform the rollout of this project, but also future interventions. And then noting the data integration alignment. Again, during this assessment process, identifying relevant data sources, where metrics might be missing, and if there's an opportunity to build that into either existing or refined data infrastructure. We'll be working with a lot of data providers. We'll have to put in place data sharing agreements where they make sense. Bring together data, to analyze as well. So, that is going to be a skill set, and we'll get to that in the next slide, that we're really looking forward to seeing in the submissions. The experience working with larger data sets, being able to analyze using certain statistical software and analytical methods. So this falling under data analysis. And then finally, with reporting and recommendations, being able to bring forward clear and concise reports as a result of these assessments, and then making recommendations to help us really leverage the data that's out there, and then systems that could be put in place to bring together more comprehensive data and information around the impact of violence among this population and its effects to housing stability and sustainment. Oh, I apologize here. This slide got cut off here. For qualifications and experience, we are looking for a master's degree or higher in the relevant field, either being public health, social work, statistics, or a related discipline. For experience, we are also asking for a minimum of 5 years experience in data analysis, community assessment, program evaluation, as applicable. And it is our hope to see, that as you submit your materials, that you're also highlighting experience working with vulnerable populations, especially among the unhoused, experience with data integration and management, and different types of data, metadata, different formats, whether that's you have experience with big data, certain statistical software packages, so specific technical skill sets. Are you familiar with SPSS or other softwares like R and SAS? And we are also looking at any data visualization tools. like Tableau or others. Um, and then experience with developing and implementing data privacy and security protocols. So really, the more you can share about your experience and the well-roundedness of it, as well as the relevancy to this project, that will be really helpful. We're looking for certain skills, and this is not an exhaustive list by any means, but really keen on the analytical and problem-solving skills, the communication and presentation, especially when there's going to be so much engagement with stakeholders, um, the ability to work independently, but also part of a team. We do have a vast advisory council with representation from service providers to youth, others leveraging their lived experiences, so on and so forth. Um, and then, knowledge on best practices is also helpful. In front of you is also just a brief breakdown of what our rubric is going to look like. I do encourage you to reference the RFQ to read more thoroughly around the valuation process. But, we will be looking at experience and qualifications, technical expertise. Some of them we just touched on a moment ago. Project team, making sure that those qualifications are in place. And that you are also submitting, you know, samples of work and references. And so I'll, in the next slide, talk about some of the submission requirements. So we are requesting a cover letter. We're asking that you keep it under 2 pages, referencing the RFQ. There's specifics around page limitations there. Within your statement of qualifications, including either yours or your firm's or your individual experience in conducting similar projects, talking about experience with analysis, community assessment, program evaluation, working with either the unhoused or other vulnerable populations that can attest to your experience, um, experience with data integration and management, data privacy and security, and really all around just demonstrating experience and understanding and working with this population. For your project team, we do request that you identify key personnel who will be involved, including their roles, qualifications, and experience. We do ask that you submit resumes for each team member. Um, with that, we do ask for project examples. We're asking for 3 relevant projects. As you provide a description for each project, your submission of sample of work can vary. It could be a presentation. It could be a link to a report that's somewhere. If there are any publications, that's also, an example of your experience. And we're also asking for 3 professional references who can attest to, the qualifications and experience. Um, as you refer to the RFQ document, there's more description around what to include around the professional references, but it is pretty straightforward as far as, the name, the organization, contact method. And then again, to remind you all that this RFQ is due September 29th by midnight. For this submission in particular, we are asking that RFQs be submitted to our Peace Project email. This is peaceproject@unitedwaysjc.org. And within the subject line, we are asking that you put in RFQ, data consultant, homelessness, and violence. And so those submission details are available in the RFQ handout, and you'll also have a copy of these slides for reference. Now, moving on to the safe storage questionnaire. This questionnaire has a similar submission timeline, but the funding availability is a little different. And Debbie, would you like to chime in on the funding over the performance period and the difference between the lead agency and the other safe storage sites?
Happy to. So the safe storage questionnaire, we try to simplify this process to help us identify an agency that can really take the lead on this initiative and the implementation of safe storage within our community. Year one consists of a site being established. That likely will be the lead agency site that wants to drive the work forward. And the lead agency is not intended to be working in a silo and alone. Again, it's extremely collaborative. It is in partnership with all of our existing stakeholders and our advisory council to help shape and form the project and the scope of the safe storage offerings for our community. So there will be two sites initially launched in year one, and you can see the respective funding that has been allocated for that. And then moving into year two and year three, it would be funding specific to help support the lead agency's role in the sustainability planning of site number one's efforts, as well as site two's, and bringing on an additional site of safe storage within our community, site number three in year two. And then in year three, again, helping to support some of the operations. Again, this was a 3-year proposal with minimal information and a true roadmap for the work. So a lot of what you see here has been rough estimates to help launch and seed the project and the funding. However, through all of this, and one of the key roles of United Way as being selected as a convener is to help support the sustainability planning for all of these interventions through these projects. Meanwhile, concurrently with all of this will be additional funding procurement as needed to help really make these safe storage sites successful. But in short, again, submission deadline for this questionnaire, again, super simple process, will be the end of the month, and hope to identify our lead agency and drive our work forward by the October 13th date.
Thank you so much, Debbie. So just to dive in a little bit with the purpose, we are seeking that lead safe storage agency. They're really going to help coordinate the implementation, extend oversight, and then take a lead with sustainability planning for the safe storage programs for beyond the performance period. We have put together a questionnaire to help assess the organization's qualifications, your capacity and alignment with project goals as we make considerations for lead agency. And so there are a few roles and responsibilities to have you be aware of. So, the focus is on establishing the safe space. But even before that, what does the safe storage space look like? And then you'll work collaboratively with the other safe storage sites to help sustain them throughout program implementation. And so there will be a lot of collaborative efforts as far as, funding procurement, like Debbie was talking about, and then just making sure that operations are pretty seamless. Coming forward will be, some best practices as how feedback is engaged from clients that are using it to make sure that this offering continues to be of value and use for the unhoused. So just providing a little bit more in terms of responsibilities. The safe storage solution is supposed to help prevent theft and interpersonal conflict. There will be development of policies and procedures, again, engagement with community partners to help identify strategic locations for these safe storage sites. And then, of course, tracking, impact metrics along the way to ensure effectiveness of the intervention. With a questionnaire, and please review the handouts on our website for a more comprehensive overview of the questions themselves. But through the questionnaire, we'll assess your organization's experience and capacity. And this is, inquiring about any existing safe storage experience or your future plans. For program implementation, inquiring about your operational strategies and any service provider partnerships that would enable success. Data collection and reporting, we'll be inquiring about your data infrastructure, outcomes tracking. Again, we want to make sure that this intervention is effective. We want to make sure that that infrastructure is there to demonstrate. So for collaboration, sustainability, we'll be asking about resources that can be leveraged as well as partnerships. We are inquiring about, operational budget and any in-kind support that could be allotted to this project. And then ultimately inquiring about your commitments. We would like to know why you're interested and, have provide you the space to distinguish your experience. A couple of items to have handy during this, the completion of the questionnaire, include your general and/or professional liability insurance. We are asking for the maximums of your policies, and if you don't have that, there's an opportunity to notate that. We'll also inquire about any relevant operational workflows, and you'll have the opportunity to upload those, as well as any relevant policies and procedures, and then again, your operational budget. So, just top of mind that September 29th is the deadline, but we're all available to help you along the way if you have any questions or encounter a technical difficulty, be it with a questionnaire or putting your packet together for the RFQ. With that, we'll transition over to Q&A. And you're either welcome to use the raise hand icon or feel free to unmute yourself. We're a pretty small audience this morning. All right. Well, hearing none, we'll go ahead and conclude our informational session for today. And remember, we are here if you need our support as you consider the RFQ for the data integration or questionnaire for safe storage. Our project email is peaceproject@unitedwaysjc.org. You can also find us on our website under unitedwaysjc.org/peace project, and you can also find us on social media. Thank you so much for your time, and we look forward to your submissions.